Ms. McElrath, can you hear me? I'm doing fine, and I hope the same for you. Wonderful. I'm not sure what order we're going in as far as presentations, but you can't see yourself? I can see you as part of the moderation panel, and you're the only one that's checked in right now. I'm not sure what order we're going in. No, I cannot hear you. We may have to get the technician. Ryan. Here we go. I think you're coming in. Yes, wonderful. How are you today?
I'm good. Can you hear me? You can hear me,
yes,
right?
I can hear you and see you very well. Okay. Yes, thank you so much for joining us.
I was trying to change my background so you don't see all of my office work to put a blur on there, but I don't see where you can do that.
And I'm not familiar with this particular platform, but if we need any help, Ryan in IT can assist us. That looks great.
That's better.
Yeah, that looks great. That looks great. Absolutely.
For it not to fall on me. And I do have a PowerPoint.
Okay, wonderful. Because I just wanted to confirm if we were doing a Q&A discussion panel or if each of the panelists will have a PowerPoint to present. So
it only has about 6 slides. So I don't see where, before it had share. Oh, here we go. Yeah, I see where I can share.
Okay.
Let me cancel that right now till I can use it. Yeah, so.
And we're just, I think there will be 3 panelists today for today's session. And I've got a short bio that I'll be introducing you ladies with that was submitted by Cara Thomas. So, feel free to take the lead after the introductions. Originally, I was told that Dr. Delaney was going to go first. We're going to go second, and I think Ms. Calvis was going to conclude our panel session.
I'm sorry, that was my son. He said hello. Calling to see if I was.
Hi.
They always call it the wrong thing.
Oh, and let's see. Oh, no, that's okay. That's quite okay. I got Dr. Delaney. She's saying she can't connect. She's got some kind of issue or something. So we might have to change the order of things because it is 10:45 and we want to say hello. Just a minute. Okay. Hello.
Hi, how are you?
Calvis, how are you? Wonderful, wonderful. Good. Thank you so much for joining us. Yes.
Oh, I'm happy to be here.
So far, we've got you and Ms. McElrath ready to go. I think Dr. Delaney is having just some slight technical difficulties.
Okay.
And I've indicated that in the chat. Hopefully she can refresh. Let's go ahead and get started. I wanted to say hello to everyone and welcome back to day 2 of the 7th Annual Beyond the Walls Conference, hosted by the Detroit Wayne Integrated Health Network. I hope everyone has been enjoying all of the wonderful speakers and activities and resources that have been shared. And I hope that on top of today's activities, it will just make it a well-rounded conference. We've had such great responses and questions and things of that nature. So I'm hoping very, very much that everyone will enjoy today's session as well. My name is Kim Price, and I'll be your facilitator for today's breakout session number 8, entitled Mind, Body, and Spirit. So let's just take care of a couple of logistics before we get started. I'd like to ask everyone who has questions to place them in the Q&A section of today's breakout session. And if you want to use chat, use that to further engage and network with the other participants. Okay? So with that being said, let's introduce our phenomenal panelists. Hang on just for a second. I do want to send out a message because we're having a slight technical difficulty here. Hello. Good morning.
Good morning.
Good morning. Do I have Dr. Delaney on the line?
Yes, I'm on.
Yes.
All right, Dr. Delaney.
Good
yes,
morning.
Wonderful. So I think we can officially begin. We've already done our welcome and we've already covered logistics. So let me introduce our wonderful and phenomenal panelists. We've got Dr. Barbara Delaney. She's a chaplain, Doctor of Ministry, Master of Divinity, and 17 years experience with the DMC Health System, working at Sinai Hospital and Children's Hospital of Michigan within their chaplaincy program. Retired after 26 years of ministry in the Christian Methodist Episcopal Church. Her philosophy of life, and Dr. Delaney,
Yes,
do we have you there?
I'm here. Do you have my slides?
I see that she's still trying to get in.
I'm
So is she there?
Yes.
Yay.
I can
Thank
see
you,
you
Dr.
and I can hear you.
Delaney. Wonderful. There we are. I was just sharing your philosophy after we did this wonderful introduction, that it is, if I can help somebody spiritually along this journey, my life is not in vain. Dr. Delaney, thank you so very much for joining us today. Our next panelist is Ms. Janet Banks McElrath, Bachelor's in Nursing, Master's of Arts in Healthcare Management, and she has staffed and supervised registered nurses, occupational therapists, and physical therapists within the DPS Schools Community District through 2011. She created an advocacy and multi-level mentoring program for young girls entitled Young Love, You and God, Ladies of Virtue and Excellence. And she's currently with the Henry Ford Health System as the Faith Community Nursing Coordinator within, and adding, I should say, involving 40 schools and faith-based organizations to help create and coordinate health and wellness programs. We also have Ms. Simone Calvis, who's currently with the Beaumont Health System as a substance abuse prevention counselor and community organizer. She's organized 4 downriver coalitions: the Taylor Substance Abuse Prevention Task Force, Lincoln Park Substance Abuse Prevention Task Force, E-Course Community Coalition, and the Downriver Anti-Trafficking Coalition. She's a member of the board of directors for the Downriver chapter of FAN, which is the Families Against Narcotics, and she brings community leaders and neighborhoods together to build bridges through education and resources. She's been quoted as saying, "The youth are our priority. They are our future, and we cannot let them be blindsided through this epidemic of substance abuse and use." Welcome, ladies, and thank you so much for joining us today.
You're welcome.
Thank you. I know that we have a few presentations, so let's get started. Ms. McElrath, would you like to begin?
Absolutely, I will. Will it allow me to share? All right. Just wanted to get started with information about our network. Our Faith Community Network, we have two networks in Southeast Michigan, Henry Ford Macomb and Henry Ford Detroit. And in total, we have over 40 congregations that are a part of our network. And it's been in existence since 1994. This is a map of the congregations that we have throughout the city of Detroit. And like I said, we assist faith communities in developing health ministries of health, wellness, and also healing. Okay, so the question is, how did we support organizations, congregations, and families during the time of crisis? Well, in March of 2020, we started meeting weekly, and we provided Zoom platforms for congregation members to engage with system and community leaders with updates on COVID-19. So weekly, we would meet because we were trying to help the congregations to continue to engage in communicating and providing information and education regarding COVID-19. We also created PowerPoints. We created processes, procedures, policies on COVID-19. So we started out with our PowerPoint on what is COVID-19 and what to be looking for and how what we needed to do to be safe. And we also collaboratively created a re-entry into the church outlines and guidelines. We engaged the university students, Oakland University and Wayne State, assisted and created surveys within the congregations that we serve and assessments to determine the needs. And we basically addressed the social determinants of health. And we provided social media platform workshops for the congregations and the leaders to show them that they could still engage with the congregants. We did Zooms, we did Skypes, we did trainings, and it was very helpful to do that. So here are some of the things that we help them provide the resources and programs following the state mandates in person and virtual. Right now, Henry Ford is coming to your home. So if you are homebound and you have not had the vaccine, we will come to your home and administer the vaccine. So this is a flyer of that right here of who to call and where to go so that we can come to your home. We also had some of the churches collaborated. Here on the first one on the bottom, we had New Calvary, Saunders Memorial, Allen Temple, AME. They joined together to do testing, vaccines, and also health screenings. And we found that doing the collaborative, we would get more people to participate. Early on in when they were doing the testing, we did get a lot of people that would come out for the testing, but as time dwindled down, we didn't. So we also tried to encourage people to the congregations to partner with each other and get the word out. We had the CARE program, virtual offerings, which is things for self-care. We had self-care topics, and there's just an activity that you could do almost every day that was virtual. They would send you a packet with supplies to be able to do things on the Zoom and virtually. And as always, we have on-site testing at our churches. We have on-site testing. We have vaccine administrations, and we partner the churches partner with the city, Wayne State, and Henry Ford. So we just do not limit to just Henry Ford. Also, we participated in a lot of informationals, newsletters. The nurses shared their expertise. We are always available to come out into community programs and within our congregations and to provide testing. We also, one of the other things that we did was we sent out information regarding the trials, the COVID trials, COVID-19 vaccine, the J&J. We did the research on the J&J, and right now we are working on a grant to address vaccine hesitancy within the community. So we have been doing things that addresses some of the things that have been that we need to talk about. This is some of the other things that we did. Volunteered during the beginning of the pandemic for on-site drive-through COVID-19 testing, also for the vaccine administration. And we also hosted clinics individually and collaboratively, and we continue to provide services to our community and congregations. Okay. Any questions?
Hi, Ms. McElrath. I don't see any questions in the chat. I'm checking chat as well as Q&A. That's where we'd like for everybody to put their questions in, just so that we can make sure we don't miss any. But so far, so good. And you got a lot of good mornings and thank you. Thank yous for your presentation.
Question that says, what is the name of the girls organization?
There it is.
Yeah, my nonprofit is called Young Love. You and God, Ladies of Virtue and Excellence. And we're like an after school program where we provide, we have engaged like my friends who are professionals and or women that mentor and work with young girls, businesses, sharing their businesses and just their expertise. I always found out that, just wanted to share that when I worked in the school system, I worked in the school system as a program director for health services. But when I was in the individual school, I found out that the little girls, they missed out on the things that we did as young ladies: jump rope, jacks, bat ball, things, just little things like that. They were into, the music and the hip hop. So we engaged them into activities that we had when we were children. And so that they know that you can just have good, clean fun other than being on the video games and watching TV. We did a lot, hit the top, running bases. Those are the things that we try to instill in them growing up, and, doing nails and little girl things like that. So it's based on giving them the experiences that I know that they don't have right now.
Thank you. And then also, Ms. McElrath, someone is asking for the phone number. Can we add that to the chat if that's possible?
For me?
Yes.
Mm-hmm. Yes.
And if you have an email address or a website that, could further, allow people to be able to reach out to you and contact you, would that be okay?
Yes.
Thank you.
What is the status of the Johnson & Johnson vaccine? I see that question in there.
Yeah,
they are still in the second set of trials. We had the first trial that where the 1-dose vaccine was approved, and that's why they rolled it out. Now we are in the second trial where the J&J individuals, back in February, I think, or March, they started a second trial with a number 2 shot for the J&J. And soon as that data is compiled, then I'm sure that it will be approved for a second shot. but they did have a second phase of the J&J vaccine research trial.
Thank you for sharing that as well. I'm checking for additional questions. And we don't have any right now. We have a little bit more time. I'd like to ask a question, if that's okay. The work that you do within the schools and the faith-based organizations with the health and wellness programs, can you share a little bit more about what those programs are and how people can engage in them? How can they access and become a part of them?
Okay, so let me start with one. If you are a congregation or you're a part of a congregation and you're interested in starting a health ministry or enhancing the health ministry that you have, we just need you to give me an email, drop me a text, and we can get you involved into our network. Our network, we have our only give back is that we have a documentation system that is really, really awesome, that you would be able to document the information of what you're doing, share the good works of what you're doing in your congregation. It is a documentation system that's used throughout the country. And it is a documentation system that we own or we created through Henry Ford. And when you become a part of our network, that is given to your congregation at no cost. Other than that, if you are outside of our network, like I said, we have at least 25 networks, health systems that use our documentation website. And the cost for an individual is $99 a year, but this is something that we give you. We ask you to come to our support groups. We have a support group monthly. Before COVID, I served dinner. We connected you with community programs. We also engaged you in grants that we wrote. We would write for the for faith-based communities, and that's an example we wrote one. We were a part of one with the American Heart Association, and we are still using the tools from that, which is a hypertension self-management program. And we ask our churches to encourage their participants, their membership, to take their blood pressure. We give you blood pressure monitors. We have nurses that follow up with you, that give you encouragement, they're coaches, and we help you to manage and bring down your blood pressure. We have a resource fair once a year where all of the community programs, I'll be contacting them. And this year we are going to do a Zoom community resource fair, and they engage, tell us what you're doing, and we also give them the platform of the congregation. So if you think about it, you have 40 congregations. Each church have between 25 to 1,000 members, and you have those congregations that come together. Think about all of the people that you are impacting with your programs. So we give that platform as well. We have the hypertension self-management program, and we also train non-nurses and nurses to be lifestyle coaches for the diabetes prevention program. We want to address the conditions that affect our people. So the diabetes prevention program is a CDC approved program, and we are fully recognized as a viable DPP site through our Henry Ford Faith Community Nursing Network. And that is, you have to 5% of your body weight and increase your physical activity and watching what you eat. All of those things are important. And that brings a person's A1C down so that they don't become diabetic. So we've even had people who have reversed their diabetes status. We've had a couple of people that were on medication that when they changed their lifestyle, they came off of their medication. So there are things that we do. We try to promote health and wellness. within the congregations, but we do go outside the box and work with the community as well. So that's a few things. I have a listing of all of the things that we meet, and the churches they love to brag about what they're doing in their congregations, and we all support each other and come together. Like if you're a part of our network and you're having a health fair, you don't have to ask for nurses because we're going to be there to help. We're going to be there to work with you. So it's a nice little family group. We all are very protective of each other and our members in our community, and we're very passionate about what we do.
Thank you. Thank you so much for sharing all of that information. I think it's phenomenal how if we just make a few little tweaks in our lifestyle, we can change a lot of things that may be going on with us. Not only the healthy eating, the healthy activities, the healthy breathing exercises, just some small things that sometimes we take for granted or don't have time to do. I know I use that excuse a lot. I just don't have time. It's not enough hours in the day. But I have to find ways of incorporating those minutes, that half an hour, to intake that fresh breath air on a walk at lunchtime. And it's conquering two birds right there, So, yeah, but I know I greatly appreciate all of the activities and all of the resources that have been created for our participants and for our communities and for our families. And Ms. McElrath, thank you so very much for sharing all that you do and your commitment to the community. Thank you. I'm looking for some more questions.
I just wanted to say one more thing.
Absolutely.
We do have groups, walking groups. I just ran in here. The time got away from me. We walk every morning, and we include other people. We include everybody. We have social media posts. We have a organization called Girl Trek. I don't know if you've heard of them, but they are a women's empowerment group that wants to attack the things that women go through. Girl Power, Girl Trek, and we do have walking groups. There's a walking group at Palmer Park on the west side. We walk on the waterfront just about every morning. So if anybody wants to get in touch with and come and meet with us, we meet at 8 o'clock in the morning. And if you're not a morning riser, we'll even walk with you in the evening. So if anybody is interested in walking, we have walkers that are available, and it's just amazing that we have some members of our church that said, my knees and my back, they're out there with their canes. They're out there with their walkers, and we don't leave you behind, but we want you to get that exercise as well.
Yes, thank you for sharing that. Is there a contact number or website or email that you can share in the chat with us?
Yes, I will pull up. We have a social media, our church, on Facebook, and you all, Janet Banks McElrath on Facebook, friend request me. I put everything we do and everything everybody else do on my Facebook page. I'm nosy and I love to tell other people business. So.
That's what it's about. We got to share our stories, right?
That's right.
Well, thank you again so much for sharing all of these wonderful resources and information to our attendees today. I'm so glad that these breakout sessions are being recorded so that they can be replayed for those who might have not been able to attend, those who might have missed the session, because they will be able to gain that very, very wonderful, valuable information. So thank you again for joining us today.
Thank you.
All righty. So we've got Ms. McElrath's information in that room for those who have wonderful things that shared with us. I know I'm interested in walking because there's my back. Everything you said. You have to really get most of that. You get some these aches and pains. As I get a little older, so I'm looking just one more time. Questions or ideas anyone wants to share at this time with Ms. McElrath? Because we're going to move on to our next panelist, and that will be Dr. Barbara Delaney. Let's see. So here, I think questions in chat. And nothing clear right now, so we are moving forward. Okay. Delaney, do we have you connected and ready to present? I think Delaney, you may be on mute.
Are you
So
ready
if
for
you
me?
can, oh, yes, we can hear you. And you have a presentation for us today as well?
We couldn't hear you. You were going in and out. It sounded garbled.
I'm so sorry about that.
That's better.
Are you able? Much better? Awesome.
Yes.
Thank you, Ryan.
Okay. Wonderful.
Kim, do you have my slides?
Actually, I do not. But I do see your window open to present. And there is a little TV screen or computer monitor screen that's at the bottom of the session. If you select that, it's going to allow you to share your screens with the participants in today's session.
Well, maybe you need to go to the next person because I need to call up the slides. What do I do? Go to PowerPoint and then?
Yes.
Okay.
Yeah. I think that might work. You
wait a minute.
Go to PowerPoint on your laptop and pull it up, and then you'll be able to share screen. Did you want me to
okay, now
go ahead and switch our time frame a little bit?
They are up now, and I need to get back to the session.
Presentation.
Yes, go to the next person, please.
Okay, not a problem. All righty. So our next panelist is going to be Ms. Simone Calvis, and welcome again.
Thank you.
To our session.
So I don't have
welcome.
a problem with slides. I am going to speak. So if you have any questions, please pop them into the chat box. So there's 3 parts to my life in corporate world. As you all know, I'm part of Beaumont Healthcare. And I also have the 4 coalitions in our Downriver area. So we are very, very involved in the community, but I'm going to go to the Beaumont Healthcare side to tell you more about our adolescent clinics that we have. So we have 8 adolescent clinics, and the mission of the Beaumont Teen Health Center is to impact the health of adolescents, which is, as you know, is my passion. That's because I have 6 children. And young adults in partnership with them and their families, schools, and communities. So we offer a comprehensive range of services to students from the age of 10 to 21 and special education. Oh, wait, there's still no sound. Are you getting that message too? There's no sound?
No, I can hear you clearly. Can our other panelists?
Yes.
Oh, okay. So now they're saying, now they're saying they can hear me. Okay. Sorry about that. So yeah, we offer a range of services to students between the ages of 10 and 21 and special education students through the age of 26. So we have general healthcare services. We have primary healthcare, school sports and work physicals, diagnosis and treatment of routine illnesses and injuries, immunizations, pap smears and pelvic exams, testing and treatment for sexually transmitted diseases. We also have HIV testing and counseling, and we accept Michigan health insurance. Though if you don't have insurance, it is not required, which is beautiful. We also have the other side of our spectrum is the health education and counseling services that we offer. So we have peer education programs related to nutrition, fitness, substance abuse, violence, sexually transmitted infections, and pregnancy prevention. We also do alcohol. We also go into the schools. We have after-school programs in alcohol, tobacco, and other drugs. We do parenting classes, obesity prevention, HIV/AIDS prevention and risk reduction, violence prevention, individual and family counseling. We have support groups for young members of the LGBTQ community and our after-school programs. So does anybody have any questions on those services that we have. Who's Kim? Kim, please go on mute. Kim, please go on mute, apparently. How do you refer individuals? So I will give you a phone number for our Beaumont Teen Center, and that will actually, I will put it in the chat at the end too. I'm sorry, I can't multitask. But the number for our adolescent clinic in Taylor is 734-942-2273. And I will repeat that again, 734-942-2273. So on the other side of our spectrum, we have 4 coalitions in our downriver area, which was Kim was kind enough to introduce each and every one of them. So my job in the community is to go out with a needs assessment and see what our community's needs are, what our SUD issues are, and our partnership with Detroit Wayne Integrated Health Network, because we are one of their providers, has been a great asset for us. Above that, we also have the quick response teams in our communities, which is the QRT program, where we share time and go to people's houses that have overdosed in our community. So we have a police officer. We also have a social worker and what we call a peer recovery coach that goes with us, that we have actually used from the 2 downriver drug courts that we have. All this integrated together is a safety net for our community. We also have the Downriver Families Against Narcotics, which we actually had a meeting yesterday with a great attendance. We recognized, which is actually on the 31st, but we wanted to do it on the day of our meetings, which are the third Thursday of every month. So we actually acknowledged the International Opioid Awareness Day last night, which was just so touching, and it was very well attended. We had drug court members there. We had community members that have lost loved ones. We had judges there. We had peer recovery coaches, social workers on hand. It really was very uplifting, and we did our candlelight vigil at the end. In heat, I might add. It was very hot outside yesterday. So that's the other side of our services. We have a very close connection with our Downriver Ministerial Alliance. We offer many services. We do resources. We hand out Deterra and naloxone. We also do naloxone trainings. Thank you to Detroit Wayne and MDHHS for their support there, and me always bugging Cara Thomas to meet me in the most obscure places to give me more supplies. So thank you. Other than that, I mean, there's a million things that we do. We are currently right now partnering with McKinley Properties to administer COVID inoculations to our community members. We do everything and anything, and we help. We have a summer prevention camp, which we just finished. It's important for our youth. As we all know, through the summer, our youth don't eat. They have less supervision. We have a prevention camp, a 6-week prevention camp in Taylor, where we actually administer the fine arts, which I think is so important. You know, I love to dance. That's not a secret. I'm a ballet dancer. And it's important for our children to engage in dance, to engage in therapy, to engage in music and drama. And at the end of it, we do a wonderful showcase for the parents to see. And every year it's an extremely successful program and can be very difficult virtually, but we've made it work. This year we were in-house. It was so good to be with the students again. It's my favorite time of the year, it truly is. So that pretty much is what we do a lot. And we're there to help anybody and everybody. So if there's anything that we can do to help, please reach out. Are there any questions for me? No. Okay. Kim, I think we're handing it back to you.
Yes, and thank you. I was having a little technical difficulty myself there, refreshing our screens and getting back to the session. But Ms. Calvis, thank you so very much for sharing this wonderful information about all of the work that your task force are doing and your wonderful work through Beaumont. I'm looking to make sure that we haven't missed any questions. I think all of our wonderful presentations so far have done quite a phenomenal sharing of all of the information and the variety. I've got someone that says, no, but I say your services are much needed. No questions, but your services are much needed. That was a comment that was in the chat. I'm going to check the Q&A again real quick. And just make sure that we're not missing anyone. Everyone, please continue to load up those questions if you have any as we prepare for our last and final panelist. And it's taken a minute here to load.
Hello.
And I just want to make sure that we haven't missed any questions.
I'm going to
I think also we've got Ms. Cara Thomas that'll be joining us as well. All righty. So we've got all the questions so far.
Assist Dr. Delaney with her.
And we had a couple in chat that we shared.
We want to make sure that.
So thank you so much again for sharing these wonderful resources. And now we're going to move on to our final panelist, and that's going to be Dr. Barbara Delaney. Hello and welcome, Dr. Delaney. How are you?
I'm good. Good morning.
I don't see.
Cara, are you going to share my slides? Cara? Okay, well, let's do it without slides. But I set it up with slides. I need you to bear with me. But I want to.
We know how to do it, though. I don't see a button that I can show you the slides through.
I'm not.
Okay, it's not letting me click it. You got to give me authority. I'm clicking it, and it is like a red circle in it. I'm sorry. I thought we were ready to share for you. I do have your PowerPoint up on my screen, Dr. Delaney.
I'll do my best without the slides, okay?
Okay. So we got mind, body, and spirit. I do know, right? You have already been introduced. Go right ahead, Dr. Delaney.
Okay, the session, as you know, was mind, body, and spirit. And as I dealt with the essence of the session and dealing with youth and dealing with adults, communicating with youth, I came up with a purpose to help youth get in touch with their thinking and help leaders assist in helping youth to be in sync with their mind, body, and spirit. So when you think about a health triangle, and there are three sides, one side is mental, the other is social, and the other is physical. Healthy lifestyle says there are three major areas of the health triangle: physical, mental, social. And it says good decisions help balance the mind, body, and spirit, and plus the mental aspect of our lives. Another triangle, health triangle that we can refer to is the triangle that deals with our theme: body, mind, spirit. The mind, what a person thinks; body, the physical person; spiritual, the spiritual person. So the questions are, how do we keep the mental, social, and physical in sync? How do we keep the body, mind, and spirit in sync? In my opinion, when the body, mind, and spirit are in sync, we have peace. Peace, from my perspective, is defined as the absence of confusion, unrest, irritability, and bitterness. We must keep the mind healthy. think good thoughts. We must keep the body healthy, eat healthy, and exercise. We must keep our souls healthy. We must have a connection to a spiritual being, and that spiritual being that I have connection with is God. So persons who deal with mind, body, and spirit and health triangles, they say that we must answer some difficult questions if we want to be in sync with our mind, body, and spirit. So what are those difficult questions? We should ask ourselves often, have my behaviors changed? Have my feelings changed?
Did I turn your video off?
Do I still find joy in things that once brought me joy? Am I being irritable or snappy at people? Am I avoiding people? If the answer to these questions reveal there's a change in your behavior, feelings, conduct, avoiding people, that means the body, mind, and soul are not in sync, and a change must take place. And that's not an easy thing to do. So as I thought about this session of our workshop, I thought about our young people and about youth and what do they enjoy? Well, they like Snapchat, Instagram, YouTube, WhatsApp, and Twitter. And I did a little more research. I said, now what do they like in terms of music? Well, we all know they like rap music, right? So I did some research. I know they like Travis Scott. They like 21 Savage. They like Lil Baby. And they like A$AP Rocky. Now, do you all know who A$AP Rocky is? I did some more research, and then so I found a song by A$AP Rocky, and the name of the song is Praise the Lord. So the chorus of the song is, now listen to this. I came, I saw, I came, I saw. I praise the Lord, then break the law. I take what's mine, then take some more. It rains, it pours, it rains, it pours. I came, I saw, I came, I saw. I praise the Lord, then break the law. I take what's mine, then take some more. It rains, it pours, it rains, it pours. Now, what does that mean? No clue. But I'm sure young people probably can tell us. When I was a pastor of a church, I had several young people. And so once a year, I would spend a week listening to the music that they listened to. I would listen to a station that played rap music. And then I would develop the message based upon what I heard from the rap artists, but not using the vulgar words. I was trying to be in touch with my young people, and I was. Once a year, quite often they would come to me and say, Pastor, when you going to preach the rap message? And so I made sure that I connected with our young people, and that's what we must do today. We must stay in contact with young people. They must know that we love them and that we want the best for them. There's a spiritual formation that helps. So what can adults do to help our children and youth grow mentally, physically, emotionally? First, we must listen to them. Secondly, we must not be judgmental. And thirdly, we must introduce them to a higher being. And there are many higher beings, but they need to know that they need someone greater than they are to help them. So when I say not be judgmental, youth likes and dislikes are different from persons who are older than they are. So we must encourage them to use social media in a respectful way. For example, if they see someone or listen to someone talking about committing suicide, they need to tell someone. If they see threatening posts, they need to tell someone. If they see someone with a lot of guns on the post, they need to tell someone because they might save someone's life. So they can use social media, TikTok and Instagram, but use it respectfully because they might save one of their friends' life. They need to talk to someone, and we need to encourage them to do that. So what about the spiritual aspect of our youth today? How can we help them spiritually? Well, in my opinion, I think that if our children do not go to church, we need to find a way to tactfully, gingerly get them to church. And once we get them there, don't complain about them talking a lot. We got to find something for them to do away from the general congregation. Maybe a youth church. Maybe a time that in the service that the youth will participate. And then we should buy them Bibles. And don't ask the parent to buy it, you buy it. And then encourage them to read a text. They're not going to read every day like we do, but they might read once a week. And tell them to start with the book of John to read about Jesus. And then if we could have a mentor-mentee relationship where the youth can talk to an adult about anything that's on their mind and heart without being judgmental. And you've heard of Take Your Child to Work Day, right? Instead of take your child to work, take a youth to work. They might be interested in the profession that you have. In other words, we must embrace our young people so we can develop a good mind, body, and spirit. You know why? Because we're all in this together. And thank you for the opportunity to participate. I'm sorry you didn't have the slides, but maybe you can get them later. Thank you.
A wonderful presentation, Dr. Delaney. Thank you so much. And we've got so many wonderful comments that are coming in. Someone mentioned that at their confirmation, they were given a Bible.
Good.
Another is saying, yes. Another is saying that our youth have much to teach us as we pray to mentor them humbly and sincerely. And we have much to learn as well. So it's a two-way street. Yeah. Yes. I didn't know who any of those artists were, but I wrote a few of them down so I can, go back through and listen to some of that music.
I didn't know them either.
Dr. Delaney. I'm glad you did the research. Thank you.
Me too. You're way more advanced than me. I need to do some of that research.
Yes, I know we have to depend on our youth for some information regarding what's going on in today's world and prepare them, as you all have stated, especially Dr. Delaney, that we're preparing them to be our next leaders. So we have to give them the tools they need to do that.
Yes.
I'm checking for additional questions or comments. You got a lot of thank yous. Let's see. Oh, we read the Bible every day at breakfast or before breakfast. Oh, that's a wonderful. Yeah, wonderful habit to have. Nice. And then it says, thanks, Dr. Delaney. She liked the way that you explained the connection between mind, body, and spirit. Wonderful. Wonderful. I'm checking the Q&A area just to make sure that we don't miss any questions or comments. I know we greatly appreciate everyone's patience and flexibility today through just some little technical difficulties, but we were able to still have this phenomenal panelist available for us And we so appreciate you ladies for making the time to join us for the 7th annual Interfaith Beyond the Walls conference this year. This has truly been an informational packed experience for me, and I hope the same thing for our panelists. If everyone can check the chat room, we have added some Facebook sites as well as websites for some of the hypertension programs, the Girls Trek walking program, and the like. And here's another comment. My grandson, who's 18, has accepted reading God's words. All right.
That's good.
Yes, absolutely. Well, we still have a little bit of time left, and I've thanked the panel so much. You just don't know how much we appreciate you joining us and sharing your philosophy and your resources with us this year. But did any of you have any other comments or thoughts that you wanted to leave us with today?
I just wanted to share that some of our congregations have been addressing the food deserts. Our church, New Calvary Baptist Church, if you give us a call during the week, we have produce, we have meats, we have everything you can think of set up in a grocery store type of situation. So we do give out food and groceries on Thursdays between 3 and 5. You can drive up, come in, or get a box. But if you come in, you can do your own personal shopping. This week we had watermelon, zucchini, celery, potatoes, sweet potatoes, cucumbers. We even had barbecue ribs in a pack. We have chicken parts, we have whole chickens, we have chicken legs, we have milk, yogurt, we have anything that you can think of to eat. We have the snacks for children, cereal, grits, oatmeal, and quite a few of the churches within the community are offering those food giveaways. So we want to be able to address that as well. I encourage any senior to link up with AARP online. They have a lot of programs to address just about anything, even concerts. You know, I attended a concert. I think Kim did a concert on AARP on Zoom. I was like, well, you know, I could save my little bit of money and just pull up the Zoom, you know, and have a concert. So there are so many resources that are out here. You don't have to be isolated. Even if you are at home, there is means for us to communicate. You don't have to be isolated. So I wanted to mention that about the food. And American Heart Association, we're partnering with them to do a lot that has to do with heart disease. And also, I don't know how you want me to share it, but Henry Ford has a limited amount of mammograms where you can go and get your mammograms. And we help you to either pay for them, you know, get a low cost or free. But we have the resources because during COVID, people weren't going to the doctor. So their annual screenings, you weren't doing them like you should. So we want people to re-engage. And if you are interested in that, send me an email. I can send you the flyer on how to register. We do have a faith day where we will be offering the mammograms. And I do believe they are not at no charge, but it is for the faith-based communities and the churches to share that information. So there are a lot of things that are out here for the community to and the congregations to be a part of. We give the information to our nurses and health ministers and the pastors for them to share with their congregation. We just and most of the things are no cost to you. And just to let you know that we are also doing the things to try and be safe from contracting COVID. As you know, that Henry Ford is requiring all of their employees to receive the COVID vaccine by September 10th. On September 11th, if you don't have your card, see ya. So I think that's something to address. That we're out here trying to prevent COVID, but then you have people that are caring for you that may be exposing you to COVID. And a very personal friend of mine contracted COVID from their physician and passed away early on in the pandemic. So I'm very passionate about people, if you can receive the vaccine, to get it, because I mean, it's just so many people that have been lost due to this, and it's unnecessary things that have occurred.
Absolutely. So many of us, I'm sure, have been a part of the devastation left from the COVID-19 pandemic. And we've lost family members, friends, associates, all over this country, not just this city and this state, but all over this country. And thank you for sharing that information. We did have something in the chat where someone wanted you to share again the name of the church that is offering the food distribution program and pantry program. Could you share that with us again, please?
I will share that with the phone number. If you are coming outside of Thursday, give us a call to make sure that we have somebody there at the church. It's 3975 Concord, and I will put the phone number in here.
Thank you. We've got a couple of minutes left. Before our session ends, I definitely wanted again to say thank you so very much to our panelists for joining us today. Thank you so much for our attendees for hanging out with us in lieu of our technical difficulties. And we wish everyone well and be well. If you need any additional information, we will have the websites, email addresses, and phone numbers available for you through the Footway Integrated Health Network. And we so appreciate your time. Thank you for joining us again for the 7th annual Interfaith Beyond the Walls Conference this year. Take care, everyone.
Bye.
You too. Bye.
Bye-bye. Thank you. Ladies, I wanted to share with you how grateful and how much we appreciate you being able to present today. Thank you. Take care, you and your families. Okay.
Thank you.
I enjoyed myself.
Wonderful.
Bye-bye.
Bye-bye.